Is healthcare really free in America? That's the question on many minds, and the answer is a resounding no. America stands alone as the only developed nation without a system of universal healthcare. A substantial portion of its citizens, in fact, are without health insurance. The United States healthcare spending is unparalleled. It's not just the highest spender in absolute terms, but also when compared to its gross domestic product. To put it in perspective, America's healthcare expenditure is like a high-rolling gambler at a Vegas casino, placing all their chips on the table, while other countries are playing it much more cautiously. Yet, despite this extravagant spending, many Americans are still left without access to basic healthcare. They're like guests at a feast who are left hungry while the food keeps piling up on the table. This brings us to a crucial question. So, is there a case for free healthcare in America? Imagine a society where everyone has access to basic healthcare, regardless of their financial situation. That's the promise of universal healthcare. It's a world where each citizen, rich or poor, young or old, is given the ability to protect and care for their own health. Now let's look at the benefits. When everyone has access to healthcare, we create a healthier society overall. Preventative care becomes a norm, not a luxury. Diseases are caught early, and the spread of infectious diseases can be better controlled. Moreover, universal healthcare would alleviate the financial burden on families. No longer would a medical emergency mean a descent into crippling debt. No longer would families have to choose between food on the table and the life-saving medication for a loved one. But it's not just about individual benefits. It's about societal growth. Healthier citizens mean a more productive workforce, leading to a robust economy. A nation's wealth is its people, and what better investment can there be than in the health of its citizens? Of course, there are challenges. Funding such a system is no small feat, but when we weigh the cost against the benefits, it seems a worthy investment. After all, the health and well-being of a nation's people are priceless. But as with any issue, there are two sides to every coin. While universal healthcare sounds ideal, it's not without its potential drawbacks. Just as there are compelling reasons to support free healthcare, there are also valid concerns that need to be addressed. One of the most prevalent arguments against universal healthcare is the potential for longer wait times for procedures. In a system where healthcare is free, and therefore accessible to all, demand for services could exceed the supply. This increase in demand could potentially lead to longer waiting periods for patients, especially for non-emergency procedures. Another concern is the potential decrease in the quality of care. Critics argue that a universal healthcare system could lead to a decline in the overall quality of medical services. The reasoning behind this is that healthcare providers may not be as motivated to provide high-quality care if they are receiving a fixed income from the government, rather than being paid directly by patients or insurance companies. And finally, there is the philosophical argument. Not everyone agrees that healthcare is a right that should be provided by the government. Some believe that it's an individual's responsibility to secure their own healthcare, and that the government's role should be limited to facilitating a competitive marketplace where people can purchase the services they need. So, what happens if you don't have health insurance in America? In America, having no health insurance can be a costly gamble. Picture this. You're uninsured and suddenly, you're hit with an unexpected health issue. You're forced to pay for everything out of pocket. From doctor's appointments to medication to hospital stays, the bills pile up quickly. And here's the harsh reality. The cost can be stratospheric. Say, for example, a routine checkup could set you back hundreds of dollars. A hospital stay, thousands, even tens of thousands. And if you require surgery, you're looking at a bill that could wipe out your life savings. But what happens if you can't foot the bill? Well, the hospital or medical practice can take legal action against you, adding a mountain of legal troubles to your health woes. So, the stakes are high and the cost of being uninsured can be financially devastating. So, free healthcare in America? A dream or a necessity? The debate around free healthcare in America is complex, with valid arguments on both sides. We've explored the current state of healthcare, highlighting the reality for those without insurance. We've presented the case for free healthcare, underlining the potential for a healthier society. Simultaneously, we've addressed the case against it, illustrating the economic considerations. The cost of no insurance can be crippling, a stark reality for many. Ultimately, the question remains, is healthcare a right or a privilege in America?